I'm the chair of the Young SIOG interest group, which is essentially a group of young clinicians and researchers interested in the field of geriatric oncology, geriatric hematology, geriatric surgery worldwide. We are a very active group within SIOG. We have lots of activities going on, and we essentially have regular teleconferences, forum to discuss research projects, papers, to interact with each other and come up with ideas that will obviously help promoting the awareness and the advancements in the field of geriatric oncology worldwide. We are also working on a number of papers in collaboration with the Journal of Geriatric Oncology, which is the official journal of the Society of Geriatric Oncology, and on different aspects of the treatment of older people with cancer. And we are obviously very eager to, get as many people involved, as many young researchers and clinicians involved, if they have any ideas to disseminate, obviously, these opportunities. Yes. I think from this meeting, it's my main take-home messages are essentially that we should really be thinking of better and more appropriate endpoints for the treatment of cancer in older patients. I was very impressed by the presentation by Dr. Isacco Montroni on the GO-SAFE study, and I was really pleased to see that he was awarded the Young SIOG Investigator Award. It is important to move on from simply focusing on survival outcomes in older patients, because obviously this is something that is not really relevant for an older population of patients in the context of competing risks, but we should really be looking at function, quality of life, patient-reported outcomes, and this is the reason why I was very pleased to see that he got the award. I think young oncologists, young geriatricians, young researchers in the field, young nurses and allied care professionals are really becoming more and more aware of this topic, or the relevance of this topic. We are dealing with impressive epidemiological changes worldwide, and not only in high-income countries, but also in low and middle-income countries, with obviously progressive aging of the general population. So cancer is a very prevalent disease. It's a disease of older people, so we will get to deal with this problem more and more frequently. I'm very pleased to see that there are a number of experiences and clinics and specific pathways being set up, not only in the historical, typical locations like the United States, France, but also, for example, in the country where I'm working, the United Kingdom, my own country, Italy, Asia, and I think our annual SIOG conference is really a good way to, channel all this energy and, team up and come up with better ideas to implement and to improve the care of all the people with cancer, regardless of the setting where you're specifically working, whether it's a cancer center, a general hospital, or anything else. I think biggest gap, a very big gap, is actually training. I completed my specialty training in my own country essentially 4 years ago, and I never received really a formal training in geriatrics as a medical oncology trainee. I think we should, in the context of this demographic changes, we should, universities, medical schools, training programs, they should really implement opportunities for trainees to, from medical oncology trainees to get trained in geriatric, and for geriatrics trainees to get trained in oncology principles. Because I think they are absolutely two fields that it's very difficult to keep separated. I think the most important update has really been the data that are still coming from the Go Safe study. I was really impressed by that. I think more data will be coming at some point next year, but I think that is really one of the key highlights of this conference. Another important update was a key oral presentation today about the challenges that we as oncologists face when we need to predict prognosis for our patients. There was a beautiful presentation by Dr. Lund that essentially confirmed that we are doing quite poorly in predicting prognosis of our patients. Whether this is because we tend to be a bit optimistic, a bit hopeful, I don't know, but certainly we need to be much better than that. The next steps will be keep up with the good work that we are doing in terms of offering young trainees opportunities to get involved in society and to come up with the ideas for research projects and so on. Opportunity to publish, because obviously it's key for healthcare professionals nowadays. Opportunities to interact with our more senior SIOG members, our mentors, and obviously, to be welcomed in and feel welcome in our society, which is obviously increasing in numbers of members. A very important aspect would be at some point maybe come up with the opportunity to work on research projects together. This is probably a bit of a challenge, but because of a number of reasons, including financial problems. But I think it's something that we could possibly aim for in the next years. Okay, so we have a very, as Young SIOG Group has a very active social media. We have a Twitter account, a Facebook group. We have a LinkedIn account as well. So whoever wants to obviously get involved simply has to send a message via our social media accounts, or obviously email any of the Young SIOG governance. Otherwise, when we are here at the conference, they just need to speak to us, and I think we are a very inclusive group of people. So the more the merrier.